Hello everyone, and thank you for watching today. What we're talking about is metabolic treatment and brain-based therapy for the treatment of chronic headaches and migraines. So if you're watching this, then you or somebody you love is suffering from a migraine condition. Now I want to talk to you a little bit about myself. My name is Dr. Aubrey Tager, and I am a board-certified chiropractic physician. I practice in the state of Vermont, and my practice mainly deals with chronic neurometabolic conditions as well as autoimmune conditions. I am board eligible chiropractic neurologist, and I am board certified in integrative medicine. I also sit on the board of the American Association of Integrative Medicine. I am in the process of finishing my first book, which will be on autoimmune conditions, and that will be published in the fall of this year, 2014. Now, all chronic health conditions have some common threads. What you're going to see is you're going to see both a neurologic component and a metabolic component. All cases have some form of one or the other. It may be 60% neurologic and 40% metabolic, or vice versa. What is metabolism? Well, metabolism is nothing more than the conversion of food to energy. So when you eat food, it gets converted down into glucose, and that's the usable form in order to promote energy. Now I've got a question for you. 30% of the energy goes to what system? Is it the endocrine system, your digestive system, your nervous system, your immune system, or your cardiovascular system? I'll give you a second to think about that. Well, the answer is your nervous system. Your nervous system is made up of your brain, your spinal cord, and all of the nerves of your body. We need proper glucose delivery and proper metabolism for a well-functioning brain. So if we don't have enough input there, if we have poor blood sugar level, we're going to have a bad brain. Now, we have what's called a brain and body connection. So your brain is a sensory organ, and everything is perceived in your brain. A lot of times I'll hear people coming in and their doctors have told them that their pain is actually in their head. Well, that's true, it is in their head, because all pain is perceived in the brain, and all pain is real to the person that is perceiving it. So there's no such thing as not having real pain. All pain is real. Your brain is going to stay alive from all of the input that gets put into it, whether it's from the environment or other stimulation. It needs input into it. So we have receptors in order to bring this information into our body. We have muscle receptors, we have rods and cones in our eyes, we have taste bud receptors in our mouths, we have receptors in our ears, we have receptors all over our body. Our body is essentially one big receptor in order to transmit information to our brain. So what is the number one receptor that we have? Touch and gravity. If we didn't have gravity, we would have a problem. We need gravity. Humans are built in order to deal with the relationship between the ground and themselves. We need gravity in order to get that information into our brain. So there are three parts of your brain. What we start to see is we're going to have the cerebellum, which is also known as the little brain. Then we have the cerebrum, known as the big part of the brain that we commonly see. Most people are going to be used to that big part of the brain here. And then we have the brain stem. Now we'll see these light up here. So there's the brain stem in purple. And how does the brain work? Well, we're going to have sensory input from different body parts. So we're going to have sensory from the cerebellum, and anything going into the cerebellum is going to go to the contralateral, or the opposite brain. Now, your upper brain has a major connection to the brain stem. It's kind of a loop, and if this loop gets broken, then you're going to have issues. You could end up having pain, you could end up having susceptibility to light. We see this a lot in patients that have fibromyalgia. Normally what we have is we have a breaking or slowing down of this process. And this slowing down is done by the brain stem. But if we've lost this inhibition or this breaking down by the brainstem, then what we're going to have is an overfiring or a loss of that loop, and that's going to cause a problem with regards to pain. So we'll see all of these different areas lighting up right now and the communication between those. Now, an overfiring or a loss of this loop, what this is going to do is this is going to cause your sympathetic nervous system. Your sympathetic nervous system is your fight or flight response. So it's going to cause that to overfire or fire too much. And when we have an overfiring sympathetic nervous system, we are going to see things like chronic pain and chronic fatigue. We could have things like irritable bowel syndrome, urinary tract infections, fibromyalgia, migraines and tension headaches, poor posture, and problems with our adrenal glands. What exactly is the sympathetic nervous system? We think of that as the fight or flight. What ends up happening is if you're standing there and a bear is about to attack you, you want to make sure that you can get out of there really quickly. So what's going to happen is your pupils are going to dilate, your blood pressure is going to increase, that's going to allow the blood to get to the extremity, and it's going to allow you to get the hell out of there because you want to protect your life. Try eating a sandwich while that happens. It's not going to happen because that's your parasympathetic nervous system. Parasympathetic is more rest and digest. So your sympathetic nervous system is going to be your fight or flight. And if this is overfiring, then we're going to see all of these issues going on. So an overfiring sympathetic nervous system can cause things like blurred vision, it can cause increased sweating, difficulty falling asleep, dizziness or vertigo, cold hands or feet, and sensitivity to light and sound. Now, your cerebellum is, as we said before, is also known as your little brain. So it does certain things. It's going to control balance and coordination. It's also going to control all of your postural back muscles. If I told you to go ahead and move the bone right in the middle of your back here, you can't do that because you don't have any control over that. Now that's called non-voluntary or non-volitional movement. So what ends up happening is your cerebellum is going to control that. It's also going to control or terminate your eye movements. So we have balance, coordination, your spinal muscles, and terminating your eye movements. So when we have a fatigue of that cerebellum, we're going to see a loss of balance. You might see some vertigo, chronic neck and back pain, headaches, clumsiness. You might have disorganized thinking and a lot of output to the upper brain, the frontal and what's called the parietal or the temporal lobes. Now, your frontal, parietal, and temporal lobes, these all have different functions. And when they are fatigued, it results in a lack of inhibition to the sympathetic nervous system. So 80% of our brains function, it could be 70 or 80%, depending on what literature you read. 70 to 80% of our brain's function is to inhibit the other 20 to 30%. So when we lose that inhibition of our sympathetic nervous system, that's going to result in that fight or flight mode. Now when we have upper brainstem fatigue or upper brain fatigue, what this can cause is depression, anxiety, difficulty in scanning pages when you're reading, so we're not going to see a normal movement of your eye movement, difficulty adding or subtracting. You may have difficulty in verbal expression, decreased memory, learning difficulties, or a lack of focus. So what we're starting to see here is kind of a crossover into ADD and ADHD. Now with upper brain fatigue, we can also see altered sensations. So you could have some numbness or tingling, decreased handwriting or changes in handwriting, body weakness, lack of motivation, and of course, as we just mentioned, learning disabilities. So when we have an overfiring mesencephalon, what that's going to cause is it's going to cause that pupil to stay wider. As we talked about earlier, that fight or flight response. It allows you to see more. If your pupil's really constricted or small, that's going to narrow your focus of what you can see. As it gets bigger, it allows your peripheral vision to open up. So this is good in the fight or flight response, not so good if you're trying to sit at home and fall asleep. Not so good if you're trying to sit there and you're in a store and there's tons of light, because this is going to cause you to have light sensitivity. This is why people with migraines have light sensitivity. So if you're having light sensitivity, you could be having an overfiring mesencephalon. Now, as this overfiring mesencephalon continues, this is going to fire to your spinal cord, to your adrenal medulla, and your adrenal medulla, your adrenals are your stress glands. So they respond to different stress, whether it's physical stress, emotional stress, or environmental stress. Physical stress can be in the form of an accident or a sports-related injury. Environmental stress could be things that happen to us on a daily basis. And emotional stress, loss of money, loss of a loved one. These are all different stresses on our body. As we have these stresses, that's going to put more stress on the adrenal glands. Consequently, what ends up happening is we have more of a release of catecholamines and norepinephrine into our bloodstream. This is going to stimulate type C nociceptive fibers. These are the pain types of fibers, and this leads to migraines. And when you have these migraines, then you're going to be fatigued due to a loss of sleep. So we see this entire process going on, and you wonder, why am I not able to sleep? This is why that is happening. Too much stress on those adrenal glands. So emotional stress, environmental stress, all of these things are going to cause things like fibro fog, or that ability not to be able to think and see clearly. Now, an overfiring mesencephalon, what ends up happening in conjunction with this is your blood vessels are actually going to dilate. As the blood vessels dilate, a lot of people think that when you're having a headache, it's going to be your brain that is causing the pain. Your brain has no receptors for pain. Don't let anybody ever tell you differently. The brain has no receptors for pain. When they do neurosurgery, brain surgery, you can actually sit there and prod the brain. Patient feels no pain. The brain itself has no pain receptors, but the nerve mesh around the brain does. So what ends up happening is, as those blood vessels are going to dilate means that they're going to open up and get bigger, then what happens is that nerve mesh around the blood vessels becomes irritated, and that causes you that migraine type of pain. So how does this happen? Chemical stress, physical stress, emotional stress. This all causes brain fatigue, and that's going to cause a decrease in nerve impulses. Now, chemical and physical stress to the brain. So what we see are some examples here. Anemia, we have too little oxygen. Blood sugar level intolerance, we start to see problems with glucose. Food sensitivities, such as gluten, dairy, and soy. Immune system imbalances, we see autoimmune conditions. Poor diet, inflammation, a lack of fatty acids. We can also see problems with hypothyroid or hyperthyroid, and hidden infections in the gut, and chronic inflammation. These are all chronic stresses on the body and on the brain. Emotional stress to the brain. Well, when we have adrenal gland disorders, we start to get what's called a cortisol imbalance. Cortisol has a couple of different functions. So it has what's called an anti-insulin effect on tissues. It's going to raise blood sugar level too high. So if those adrenal glands are not functioning properly, your blood sugar level can increase. This is also going to cause some problems with high triglycerides and your LDL and cholesterol as well. So high insulin and glucose levels cause a breakdown of your brain and your nerves. Now, metabolic disorders can also be causing brain imbalances. So when we have a metabolic disorder, we can see things like anemia, blood sugar imbalances, food sensitivity, immune system imbalances, thyroid dysfunction, inflammation, and hidden infections. Do you know if you're suffering from any of these? If you haven't been tested for it, then you would not know. And by simply taking something like a Maxalt for a migraine and not going and checking all of these different metabolic conditions, and if they are the cause of the problem, you will never get to the actual root of the condition. So what do? We want to make sure that we're doing proper testing. Have you been told that all of your lab tests, if you have been tested, are normal? Well, lab ranges are inaccurate. They use bell curves. And functional lab values are a little bit more sensitive. And what that's going to do is it's going to reveal problems. So this is why lab tests are normal, but you might still feel sick. Because if we're having a range here that's either too high or too low, we don't know if there's a problem. We want to make sure that we're closer in the middle here. So if your blood sugar level is 120 and you go in to see your family doctor and they're telling you that your normal blood sugar level should be between 80 and 120 and you're coming in at 110 or 120 and they're saying, well, you're not diabetic, but let's keep an eye on it and we'll see if anything happens. And then when you become diabetic, we'll give you some glyburide or glucotrol or we'll stick you on some insulin. Why would you want to wait until you had that problem? So what we want to see is we want to see a more functional range. So something that's tighter, between 85 and 100 here in the US. Or if we're looking at things like TSH or cholesterol or hemoglobin, we just want to make sure that those numbers are a little bit tighter. Now, based on your history, we can run a multitude of different tests. We can look at your complete blood glucose level. We can look at a complete blood chemistry panel, salivary tests, looking at your adrenal glands, including the different cortisol that's released. We can also see if there's any problems in your gut or any infections or parasites that might be going on in your body. We can also look at food sensitivity to see if you are sensitive to gluten, dairy, or soy, or any other foods that are going to resemble that type of food. That's what we call a cross-reactive food. So how is brain-based therapy different? These are the types of therapies that we do in our office. Well, brain-based therapy is going to function specifically on the brain itself. So what we see with that is we want to find different areas of your brain that are weak or understimulated, and we want to correct them. Your cerebellum and your brain needs two things to survive. It needs fuel and activation. All of my patients know this because I talk to them about it all the time, and I have them on what's called an upper body ergometer in conjunction with oxygen. Why? Because your brain needs two things to survive. It needs fuel and activation. Fuel comes in the form of glucose and oxygen. When we hit age 25, every year after that, we lose 1% of our body's ability to utilize oxygen. This is called oxidative phosphorylation. So if we don't have enough oxygen in our body, then we're not getting enough information, we're not getting enough fuel delivery to our organs and to our brain. It's kind of like the way a car oxidizes. It's going to rust. Your brain's going to rust too. So we want to make sure we have enough fuel. The second thing is we need activation. Your brain needs to be exercised. So we need to do things in order to stimulate that brain. So is oxygen essential for brain activity? It demands at least 20% of your body's oxygen supply. So when it doesn't get that, what you're going to have are certain things like sleep apnea, poor concentration, forgetfulness, mood swings, restlessness, depression, and low drive. Extra oxygen has been shown to enhance mental performance and memory recall in healthy active adults in several clinical studies. So one study that included 109 different adults, the researchers found that 78% of the patients who received oxygen reported being pain-free to have adequate relief within 15 minutes of treatment, compared to 20% of patients who received air. There were no serious adverse events related to these treatments. And this is from the Journal of the American Medical Association. So what are the main benefits of using oxygen? Well, stimulate brain activity, we want to boost concentration, we want to calm anxiety, we want to reduce stress, and we want to detoxify the blood. These are just a few examples. So some of the therapies we use, as I mentioned earlier, an upper body ergometer. We could use, or we do use, an oxygen concentrator. This takes 95% pure oxygen while exercising. It activates your cerebellum and it provides fuel and activation. This is totally safe, and we have this in our office. Some other therapies that we use for brain activation include vibration therapy, on one side of the body, gentle neurological adjustments, unilateral adjustments, warm water calorics, vestibular, ocular exercises, olfactory stimulation. Smell is actually a very good thing and helps people with migraines tremendously. We might also use things like visual or auditory stimulation, using different types of colored lenses, hemi-field glasses, eye exercises, mazes or word searches. We might use large letters made up of small letters. All of these are focused on specific areas of the brain. So it depends on what we find with a patient when they come in. Some other therapies we have are metronome therapy, eye lights, optokinetic tapes, rebuilder, and many others. What is the solution to chronic migraines? Well, proper metabolic testing, nutritional supplementation in order to correct the metabolic deficiencies, proper functional neurological exam in order to find these brain imbalances, and brain-based therapies with oxygen in order to correct brain imbalances. When we have a neurological breakdown with metabolic complications, we start to see all of these different things, your cerebellum, your cortisol, all of these are not working properly. We want to make sure that we bring everything together. So when we have that entire approach together, it brings that whole pie together at the same time. So what's next? Well, the next thing to do is call our office. In our first visit when you come in, what we'll do is a complete neurological exam. I'll review any kind of labs that you have already. We're going to have you fill out a metabolic assessment test and a neurological test, some of these papers. I also ask that everybody brings their spouse with them. If you've ever gone to a doctor, and they tell you something and you get home and you try and tell your spouse or significant other what's going on and you really don't understand and everything gets lost in translation, if you've got a problem, you need your support team with you. And I really try to stress on people to bring that support team with them into the office so that they can see what's really going on and what needs to be done in order to help them. On the second visit, what I'll do is I will go over a case review. I'll review any kind of findings that we had through the neurological examination, as well as giving you my best recommendation. And we will also review any kind of financial obligations. In this visit, I have to insist that you do have that significant other with you, because if we have to make any kind of recommendations, we really want to make sure that you have your support there. So I only accept about 5 new migraine and chronic headache patients per month. That's because it really takes a lot of time in order to come up with these plans. And the first 2 visits generally cost about $450. If you want to make an appointment after watching this video, and right now we are in the summer of 2014, that visit is only going to cost you $75. With that $75, the next 2 visits are going to be at no charge to you, and you'll be able to see exactly what we do at no cost to you for those additional 2 visits. If I feel I cannot help you at all, I have no problem giving you back your money after the examination. Now, 3 rules for the acceptance of your care. You must be willing to make serious life changes. You have to take accountability for your health, and insurance or Medicare is only going to cover a small portion of it. We try and make our care as affordable as possible. So over 95% of our patients can actually afford this care if there is no coverage under their insurance or depending on what insurance pays. We make it as affordable as possible. It could be as little as $150 to $300 a month. And if you've got a chronic condition, you know that this is well worth it. So on a scale of 1 to 10, how serious is your illness? How has this affected your relationships, your work, your ability to enjoy your life? If you're having migraines, this can really stop your entire day in its tracks. On a scale of 1 to 10, how serious are you about eliminating the migraines from your life? Now, due to time constraints, I can only accept those that are really, truly committed. I want to do nothing more than to help people. But I want to make sure that I'm going to have people that really want to help themselves. So when you're ready to make a commitment and you're really serious about making a change, please give my office a call at area code 802-230-4678. You can also send us an email to info@gethealthyvermont.com. I hope this helped you a little bit, and I hope it gives you some answers into why you may be suffering migraines and some things that may help you in order to get rid of those migraines. Once again, I'm Dr. Aubrey Tager, and I look forward to speaking with you soon. Have a great day. Bye-bye.